5. SPECT scans have the potential to aid in the diagnosis and treatment of brain trauma, which is just so commonly missed in psychiatric medicine. I always say, how do you know unless you look? In fact, if you ask me, you should go, okay, Dr. Amen, what's the single most important thing you've learned from looking at a scan? Mild traumatic brain injury changes people's lives, and no one knows about it. Why? Because people who have behavior problems, they have problems with their mood, problems with their temper, problems with their memory, problems with learning. Nobody is thinking about the car accident that they had where they didn't lose consciousness, but my goodness, it certainly rattled their brain. And SPECT scans just have great potential in, one, understanding, did the trauma affect your brain? And then two, if it did, what are the specific things I can do to boost your brain, stabilize it, or if there are areas that are overactive, calm it down. So brain trauma is just a very important clinical indication for SPECT. 6, SPECT scans have the potential to aid in the diagnosis and treatment of seizure disorders. It's so interesting to me. In psychiatric medicine, we use anti-seizure medicines all the time. Now, we call them mood stabilizers, medicines like Depakote or Trileptal or Lamictal. And what we're really treating, I think, are many behavioral seizure disorders. And those medicines, as they help stabilize brain function, they can decrease your anxiety, they can stabilize your mood, decrease aggression. And when we have the scan information, it's just so important. I talked to a boy today who I treat who has a left temporal lobe abnormality. His left temporal lobe doesn't function right, and he's got these dark, evil, awful thoughts. And on an anti-seizure medicine, he's just so much better. And scans really help us to understand seizure phenomena, especially as it relates to behavior, and then target your treatment. 7, SPECT scans can add valuable information to the prevention, evaluation, and treatment of substance abusers. When I first started doing Brain SPECT Imaging in 1991, I was the director of a dual diagnosis hospital unit. In a psychiatric hospital, a dual diagnosis unit is we're taking care of substance abusers who also have psychiatric problems, which in my experience is most substance abusers. And what I found were the pictures were extremely powerful in showing people the damage they were doing to their brain, and also to help them understand why they may be using drugs. So for example, they'd see their scans, be horrified by them, so that would be great incentive for them to stop using. But I'd also see, well, maybe they had a brain injury that I needed to treat. Or maybe they had attention deficit disorder, or they had patterns that were consistent with anxiety or depression. And I'm so excited because Sierra Tucson, which is one of the world's best drug treatment hospitals, recently put a SPECT camera in their hospital and we read their scans. So I'm just really excited as my work is being disseminated to the world, especially in helping people that have problems with substance abuse. 8, SPECT scans have the potential to help differentiate between the different types of dementias, like Alzheimer's disease, vascular dementia, alcoholic dementia, frontal lobe dementias. Plus, scans really help in the earliest diagnosis and prevention of memory problems. I do a lot of work with people who have Alzheimer's disease or other kinds of dementia in their family. And they're worried that they're going to get it. And I actually think people should have a SPECT scan in their 40s or early 50s if they have it in their family to know what their risk is, and then to get on a very specific, targeted Alzheimer's prevention program. Research from New York University suggests that we can tell about 10 years before people have their first symptoms whether or not they're vulnerable to get a process like Alzheimer's disease. And why do you want to know early? Because that's when you can intervene. that's when you can do something important about it.